So on a personal level, I was actually born and have spent my entire life in Massachusetts, I guess, other than my time at the University of Vermont. I actually married someone from Massachusetts, and we now live in the North Shore with 3 kids, all under the age of 11. So you can imagine things are pretty busy in my household. From a professional perspective, I have 20 years of experience in the insurance industry. And over the last 12 years that I've been with Delta Dental Massachusetts, I've had numerous executive roles. And what I would just say is I could not be more excited or energized to take the leadership role today. When I took this role, I knew there would be a number of opportunities, but also a number of challenges. And so with the passage of the ballot question last November, we knew that there was a need for us to come back together as an oral health community. There are a lot of challenges. We have to work together to solve them. We'll do a much better job if we do that. Part of being a good partner is being a good listener. And so one of the things we've done is actually spend time and prioritize my time to go out in the community and meet with dentists all over the state. And it's been a great opportunity for me to both understand their businesses and hear about and see their locations, the offices they spend so much time on, but it also has given me an opportunity to hear direct and candid feedback about the things that we do well, the things that we need to focus on in the future. To those dentists that I've met with, I really appreciate your time. I know you're very busy, and I look forward to meeting many more of you in the coming weeks and months. So one of the biggest challenges, both the dentists in Massachusetts, the oral health community in Massachusetts, but also on a national level, we're dealing with is workforce shortages. And this plays out in a number of different ways, including increasing costs and challenges with relative to access. This is obviously a big focus of ours, and it's also something that we hope Delta Dental and the dentists can actually work together on to develop solutions for. So this is a big focus of ours. You might have noticed most recently, we announced a pretty significant endowment to local community colleges to support underserved populations that want to enter the dental hygiene space. Again, this is a focus of ours, and we really want to be part of the solution. So I'm very cognizant of the fact that I am taking on this role at a very unique time. With the passage of dental loss ratio on the ballot question last November, it fundamentally changes the way our organization in the industry has to evolve. Now, we know that there are a number of questions, and the regulators and the Division of Insurance are working on that. So I can't tell you how the rest of the market will adopt this legislation, but what I can tell you is Delta Dental is embracing this, and we're leaning into it. So we see this as an opportunity to reimagine our organization and oral health care in Massachusetts, and also use this as a moment to create incremental value for all of our stakeholders. That would be our dentists, our clients, our members, and our providers. One of the most interesting statistics I've heard is that over 90% of systemic diseases can actually have a manifestation in the mouth. That means that often there are scenarios where a dentist could be the first person that identifies a systemic disease. So I think, and there are a number of other studies, I think the fact is that oral health is critical to overall health, but I don't think we're necessarily there as an industry to adopt that yet. So there's some fundamental changes that need to happen. One example would be more effective sharing of data across the entire healthcare ecosystem. I think the biggest opportunity for us as an industry is to look for ways to elevate the important role that our dentists play in improving the overall health of their patients. So what I don't think will change is a continued focus on prevention. I also think that we're going to constantly want to make sure that our members and our patients are actively engaged in seeing their dentist on a regular basis. One of the things that really impresses me is the amount of innovation coming to our industry, both technological and clinical. So I think it's going to be really important that we think about how we can adopt those solutions, particularly those solutions that improve outcomes and reduce cost for our patients. I'd like the dentists to know that they have a partner in me and someone that is willing to listen and work with them on solutions that we think will benefit both our patients and the broader oral health community.